I think this is a great excitement, especially this year, because after the breakthrough in 2013, especially in multiple myeloma, we finally find a very specific multiple myeloma target. It's called BCMA, B cell maturation antigen. And just in recent 2 years, I think upon the successful clinical success in BCMA BiTE T cells from thus far, we have already have, I think, 3 or 4 BCMA CAR T therapies has all shown very high response rate in human multiple myeloma cells with very heavily treated human multiple myeloma cells. They have no treatment options after several relapses. Some of them are more than 5 to 7 or 5 to 13. And as you can read it from the report. And BiTE is another very exciting area that is also using T cells, effector cells, that similar mechanism to target tumor cells, but this is more adaptive. It's through a antigen antibody platform instead of the T cells. T cell is a cell therapy, whereas BiTE is kind of similar to the antibody therapies. But rather than activating NK cells thus far, I think the first is very successful. And in preclinical setting and also in the clinical setting, the first BiTE is Amgen 420 has already been shown very high response rate. And compared to these two approaches, they generate a lot of excitement because of high response rate overall speaking. However, BiTE is still a little bit different from CAR T therapy in terms of mechanism, because BiTE can be administered, but when you don't need that, they just go away. Instead of CAR T cells, they are inside the patients once you give it in the patients. So there's a advantage and disadvantage, but overall speaking, it's very successful. In clinical, has already shown very successful rate. So just these 2 or 3 years generates so much excitement in this area, and we are currently trying to improve because we do see patient relapse already. So this is kind of a lot of work needs to be done.